Arup sir?
Yeah, start off. Yeah. Respected RDR sir, Secretary AIS Dr. Namrata, President KSOS Dr. Sai, Secretary KSOS Gopal, Scientific Committee Chairman Dr. Srini. In the early 90s, when I was making baby steps in extracapsular surgery, Dr. RDR has just returned from USA. And looking at me struggling with wound closure, he said, Arup, do you know in the West they have started doing sutureless surgery? So before it sank in and I wanted to ask him, he was gone from the theater. So evening I went to the library and read up everything, and that was the beginning of my journey in sutureless cataract surgery. So Dr. RDR, I have noticed the roles that he has played in the growth and development of Arvind Eye Hospital. Whenever there was a new project, new venture being taken up by Arvind Eye Care System, Tirunelveli Hospital was coming up, Dr. RDR started it. Coimbatore Arvind Hospital was planned, Dr. RDR went there. Pondicherry, when Arvind branch started, Dr. RDR. So I used to tell him, sir, you are so lucky in the sense that at such a young age you have been given such important roles to play, and you have played those roles immaculately. You know, I mean, you have taken Arvind at a totally different level, and your contribution for the growth and development of the entire eye care system is something which has to be only, praised. Last week I was in the GSI meeting. Wherever I saw, at least 30 to 40% of the members, the speakers, the members, delegates, all of them were trained at Arvind, some of them during my time, most of the time after I had finished. And then I realized the true impact of the Arvind Eye Care System. I got the total picture. The role that Arvind Eye Hospital has played in developing the glaucoma care in the country. And same thing holds true for all other facets. The cornea surgery. My wife is a retina vitreous surgeon, one of the first to start in Kerala. Then yesterday we were sitting on the dais, Dr. Chandrakant and myself. We are all trained at Arvind Hospital. So they have, without them, in ophthalmology in India, I'm sure would not have come up to a level where it is there today. When I go abroad, international meetings. In the late 90s, Arvind's name was just building up, but to the last 1 decade or so, every person that I meet, when I tell them that I have an Arvind background, they have a story to say. There's a group called Eye Care International, which was part of ASCRS. So the group leaders, they have taken turns to come to Arvind to learn small incision cataract surgery. And the Latin American countries, South American, the African countries, the way the ophthalmic care has been impacted globally, nothing would have been possible without the role of Arvind Eye Hospital in healthcare, in training, in the industry, in the product development, and so on and so forth. And I have tremendous admiration for Dr. RDR, not only because he has played such an important role, but because he has this ability to, inspire you. He has reached such a high level, but still he has his feet on the ground. Anybody can approach him at any time, and that is the reason when we are thinking about a candidate for the Dr. T.K. Oration, Alexander Memorial Oration, we did not look any further than Dr. R.D. Ravindran, and then this was communicated to the KSOS, and KSOS was extremely happy about it, and rest, as you know, they have taken it forward. And sir, we are really indebted to you, not only for your acceptance of this, our endowment, our memorial oration lecture, but the role that you have played in developing ophthalmology nationally, globally, and in every facet of ophthalmology, the way Arvind has touched us. Thank you so much for coming here.
Thank you, Arup sir. It's my proud privilege to formally introduce RDR sir. My guru, Dr. J.K. Reddy, introduced me to him in one conference, and the next conference, he saw me from somewhere and called me Srini. So see a nobody being there in his mind with just one contact. That's what RDR sir is. And next slide. Dr. R.D. Ravindran specialized in the field of cataract and intraocular surgery, started his practice under Dr. G. Venkatasamy, the founder of Arvind Eye Care System in 1987. In his initial years when Arvind opened a new center, he was identified to be the Chief Medical Officer, and thus has was hands-on experience in developing new hospitals like Dr. Arup just mentioned. After serving as the Chief Medical Officer of various Arvind centers for close to 23 years, Dr. Arvind Eye Care System in 2010. Apart from managing and mentoring the key leaders of the institution, his areas of interest include teaching eye health management courses leading to capacity building of eye hospitals. He served as a regional co-chair of International Association of Prevention of Blindness from 2004 to 2012 and is a board member of Vision 2020, the Right to Sight India since 2008. Next slide. At Arvind Eye Care System, he is the chairman of Arvind Eye Care System Madurai, professor of ophthalmology, Arvind Eye Hospital and Postgraduate Institute of Ophthalmology, Madurai. At national level, he's in the advisory board of NPCB. He's a member of Academic Council, Health Sector Skill Council, New Delhi since 2022. So these are the positions he held in TNO and TNO affiliate associations. He was organizing secretary of 30th TNO Annual Conference, Tirunelveli in 1990, president of Coimbatore Ophthalmic Association 98 to 2002, chairman scientific committee 47th TNO Annual Conference 1999 at Coimbatore, chairman scientific committee TNO Annual Conference Pondicherry 2006, President Pondicherry Ophthalmic Association 2007 to 2009, member managed committee TNOA for several years. The past positions held at national level, board member Vision 2020, 2004 to 2012, he was the regional co-chair of International Association of Prevention of Blindness, Southeast Asia region, member of Task Force on Standard Treatment Guidelines, member of the Expert Committee of National Accreditation, NABH, for formulating standards of eye hospitals 2016 to 2017, member Sector Innovation Council for Health, National Health Systems Resource Center, Government of India, served as advisory board member, NPCB, served as member of AOS Trade Relations and member Grievance Committee for 2 years, and in AO's Presidential International Relations Committee for a year. He has 87 publications in peer-reviewed journals. He's a reviewer for Asia Pacific Journal of Ophthalmology, BMC Ophthalmology, Indian Journal of Ophthalmology, Middle East African Journal of Ophthalmology, Journal of Cataract and Refractive Surgery. He has a huge lot of awards and recognitions. If I start reading that, we can't give him time for his oration. So these are the several awards and recognitions that he has won. Thank you, sir, once again for agreeing to deliver the Oration Award. Please, sir, come on stage.
It is a proud privilege to have RDR sir delivering the oration today. Dr. Gopal, our secretary, is accompanying RDR sir onto the dais. Sir, please come.
General Secretary of All India Ophthalmology Society to hand over a memento to RDR sir. I request sir to start the oration.
So good afternoon. At the outset, I would like to thank the president, outgoing president, Dr. Arup, incoming president, Dr. Sai Kumar, Dr. Gopal Pillai, the secretary, and also Srini, and all the office bearers for the real honor. I know that there is only one oration given. Unlike several other institutions, there are several orations are given, but here there is only one as a really prestigious oration award. I'm really, really thankful for this. And I have chosen a kind of a non-clinical topic. And I think this is very important. As Dr. Ramani mentioned today morning, I think the whole medical profession is at crossroads, where there is a kind of a lack of trust among the public on us. I think how do we build it? It's for the greater good of the whole profession. I think we have to really build that trust among the patients and the community. It's very, very important. Something what I'm going to plan to talk is kind of touching upon that. I mean, so we all have one common challenge. Can somebody say what it is? Anybody here, whether a private practitioner or a group practitioner, institution? So the one challenge all of us have is how do we grow the volume of patients? Whatever practice, whether you are an individual or belong to institution or a group chain of hospitals, growing the volume of the patients is very important. And because the expenses tend to grow, and we need to really address that, and that can be done only when the volume of patients grow. And this has to be done in a very sustainable process. Only if you do it in a very sustainable way. We can grow the volume in many ways. But if it is done in a sustainable process, it will take care of all the other processes like, breaking even, bringing efficiency, effectiveness, bringing visibility to your practice or your organization in the community. So in many ways that growing the volume becomes very, very important. So there was a study in America looking at how the patients choose a provider, how the patients choose a doctor. So they gave them different options and asked the patients to grade them as this source. This source is very believable. This is somewhat believable, not believable, or not at all believable. So they gave them, but they can mark many. They can choose many things. And when you looked at the data, the patients believe the data from the family and friends. They will normally go to a family or friends, or they may go to their family doctor. So nearly about 80% of them go either to their family or the friends. As you can see, even there, the people, the whatever information they comes in the newspaper or TV or some other media, nearly only 5% of them only take it as a believable information, or they use that information to choose a doctor. So what it means is that nearly 70% of the patients come based on the previous patient's positive experience. So we have done this kind of a study looking at from where our patients come, how they come, what is the information because of which the patient is attended to your hospital. Even in an eye camp, we used to do this, and it's always based on the previous patient's experience. So leveraging that word of mouth is very important. And how do we leverage? It's all about the quality. So when you look at the quality, there are two aspects. One is the clinical quality, which is the medical care, which is very important. The nursing care and the outcomes and the complication rate is all that is very important. All of that relate to the clinical quality. There is no doubt that it's very important. And equally important is the service quality, how the services are priced, whether it is really affordable, is it accessible, and also what is the ambience and the facilities. So many other things also they look at it. The service quality is also important. Even more important is how the staff interact. So you may have a good clinical quality, you may have the state-of-the-art facility with all facility, but still you may not do well because it may relate to the way the staff interact, the doctors interact, the other support staff interact with the patient. So all three are equally important, and I've chosen to talk about the staff interaction, because this is the software, no, this is the key, this is the spirit of the organization, which is the staff interaction. Because today, one doctor, I can ask, many ophthalmologists used to ask how many support staff you have, how many nurses. The answer varies anywhere between 7 to 10 staff. If you have 2 doctors, it's between 15, 16. So today I see many ophthalmologists have at least 1 or 2 ophthalmologists supporting them, and they have close to 20, 25 other staff. And the interaction of the staff with each of these patients is a moment of truth. Okay, so if we have, not only the ophthalmologists have to give a good experience, but it's also important that everyone in the team also gives that good experience to the patient. So how do we ensure this good experience and satisfaction in our practice is what I'm going to talk. So when you talk about patient experience, and any patient coming to a hospital, they'll be able to experience the hospital services just by simple observation. Okay, the way we have structured. They look at all the facilities, services. By hearing the interaction between the patients, between another patient and another. It's not necessary about what they talk to this particular patient. They also keenly watch how the staff talk to other patients. And also when you talk to the staff, in reality you also you understand. There is an experience. Then also when you undergo the actual procedure, you really get a full experience. So all of that is important, and these are all comes from how the team members of the hospital, how the staff interact with the patient is very important. It's also equally important how the staff interact with each other. That's also the patients really watch, how that happens. So both are very important. It's not just about patient's interaction, but the team, how it really puts up itself in front of the patient is also equally important. Now, if they have a really good experience, I just read it here. Here the patient says the hospital service is very good. We are very satisfied after coming here and are now keen to donate our eyes. We had our daughter's eyes tested here. We were so satisfied with the care that whole family came for the eye test. Now our entire family has pledged to do eye donation. So they've gone a level high. So to a level there, they are pledging their own organs. So that can also, if the experience is really good, they are going to send you a remark like this or document their appreciation. The same thing can be a complaint. So this is a complaint. So this is a patient coming from Trichy. This is only like 2 to 3 hours from Madurai. On the first visit, they said I have to get a scan done, but for some reason the scan request was not given. But when the patient came next time, it took a long time to write out the order for the scan. Then it took about 2 hours to get the scan done. So I had to come back again today to show the scan report. So this took less than half an hour, the subsequent visit. He says that if they had sent us quickly on the second visit, this could have been avoided. So it's a kind of a really relevant complaint. Somebody, if the people had been really sensitive to a person who has traveled 3 hours and they have attended to the patient and made sure that this was done, this complaint would not have happened. We would have had another happy patient. So what really happens? How do we ensure a good patient experience and satisfaction? So it is about answering 2 questions. So one is what the patient wants. The second one is what the patient needs. So both are equally important. Okay? So what the patient wants requires thinking like patients and what will satisfy them. So now usually patients come with certain complaints. Okay, and we really need to address that primary complaint. You may know, but at the same time you may examine a patient who had come for a presbyopia class, and you see the patient has got or suspect glaucomatous disc. We would like to examine that and do that. So that is also equally important. What the patient needs, a diabetic patient coming for a regular examination, we need to do a dilated fundus exam to make sure that he doesn't have a sight-threatening diabetic retinopathy. So what the patient wants, we have to really address that, and we also need to think like an ophthalmologist to understand what the patient needs. And equally important is that how do we do this with a value-based system? How do we do it with a compassion? How do we do it with an empathy in a manner that will maintain the patient's dignity? So this is important. So understanding the patient's wants and needs is important, and how we also respond to that is very important. So what drives the patient experience is the work culture is what gives the patient experience and also gives identity to the hospital, to the whole system. That work culture, if you look at it, the work culture is driven by the values practiced by the staff in their day-to-day activities. That's what it comes down to. So what are those key values? If you look at it, there are several values which are important. But in a practice, I think the key elements are how do we make sure that our staff exhibit a compassion and empathy? How do we make sure that we exhibit equity? How do we make sure that our systems are transparent? So these are really a core values. If you are able to implement them, then we are able to really give a good experience to everybody. It's, what we are talking about is not just the patient. So if the patients are able to have a good experience as a staff, everybody in the organization also have a kind of a job satisfaction. They also really feel satisfied with the work. So implementing these values in patient care is the role of the ophthalmologist. Whoever leads that organization, it is that person's role. Which means, the person who runs the organization, who's in charge of, whatever, it may be an individual practitioner or it may be a group. So you have to understand how the value manifests in your work, in your day-to-day work. And how, because it's important, if you don't understand how it manifests in your work, how these values are presented in your work, translate into work, you will not be able to communicate it to your staff. So understanding is very important. Equally important is how do you design the systems that will reflect these values. So how these values will express whatever work process you have put in place, how will they express these values? So these two are very important. To give you an example, so patients really appreciate the way how they are cared and approached or respected. So this is a manifestation of the compassion and empathy we show in the organization. And if you look at the work process, how it manifests in our work, it is about viewing the patient as a person. Sometimes we look at them as a piece of pathology, okay, as a patient with a cataract or presbyopia. So, but if you look at as a person, that somebody who's got a family, he has to take care of the rest of the people in the family, then there is a different value, way you look at the patient. Then treating them with dignity. No point of time, in spite of the fact somebody may become harsh, how do we really treat them with dignity? And this has to be shown in whatever communication. You should be able to, the staff should be able to express that caring, whether it's verbal or non-verbal. Sometimes the verbal communication may reflect caring, but the non-verbal communication, the body language will be communicating the opposite. So both are equally important. And again, how do we respond to the patient's request, which may not be out of the way, but how do we also respond to that? So this is where the systems become important. So here we are talking about how the staff behave with our patients. So how do we communicate them? How do we structure the counseling? Counseling is not tell them what is the time or how much it is going to cost, what this IO will benefit. But instead, if they bring in the value of compassion and empathy, and then the way they'll counsel will become very different. So sometimes you may have, the system may have the element of compassion and empathy, but if you don't have a protocol, how we are going to manage vulnerable patients. For example, if you really want to take care of vulnerable patient, you must have wheelchairs available, stretchers available at any point of time. Wherever the patient comes in, you should have a system. How do we identify these patients who need a wheelchair? Who will be responsible? Who will provide them? Instead, even before the patient asks or the attendant asks, whether we can provide that to the patient. And again, handling emergencies. If you have a system to manage emergencies, then it will work. Just having the values is not going to matter. So the systems is also equally important, which will drive the cultural component. So equally important is patients appreciate knowing that they'll get the same good care regardless of their status. So that is now also one concern all the patients have. If you are able to address that, that's going to bring in a lot more patients. I've heard many times in Aravind, I don't need a recommendation. So I just come, everything gets done. So which means, when you look at the work process, it's about clinical protocol and the patient flow are not influenced by patient status. It's also about responding to the need of each individual. So if you are able to do that, and if to do that, you need to have a system where our staff should understand the patient's condition determines the treatment. The way we segregate the patients, the complex patients are handled by competent people, not necessarily by the junior people. So you have a system to do that. The staff, at least in our system, the staff are not segregated by patient category. You offer a range of choices so that the patients will be able to choose, and anybody who comes into your system, they are able to pay for it. That really brings the element of equity. And in some instances, you may also have to be financially supportive of the patient's need. So all of this will reflect. These are all the work processes that will help in improving the satisfaction and the other thing. Similarly, patients also don't like cheated either in the treatment process or the fees. They should not even have that feel. Okay? How do you do that? It is about having a uniform fee structure. Here, the systems are more important. Now, how do we structure our patient flow? How do we make sure that there's information is available so that they can make an informed consenting process? And how do we do the consenting? So the whole thing is very transparent so the patient really understands. So which means it's also about every staff respecting the laid down systems and following upon the protocols. And the hospital also should have a system to absorb unexpected costs. You have told them this is a package cost. You should not go back and tell the patient, it has cost you more, you have to pay that. No, I think if you are able to absorb, that may be less than 1% of your revenue, but if you are able to absorb that, that's going to have a tremendous effect on the way the patients look at the organization. So this is basically, I've tried to give you an idea, how do we convert a value into a work system and as a work process, and how do we have a systems to implement that. So one is, we have talked about the system. So as we have seen, the systems will align the activities towards the value, and usually when you have a good system, it also makes a system effective and efficient. So that's the strength of a system. But if people have to practice the systems with the understanding of the value, very often what happens is, you put in place a system, people practice the system, but they don't understand the value. If you don't understand the value behind the system, why we do certain things in a particular way in your hospital, then no improvement is going to happen. Because if anything, that system is challenged, people cannot think. But if people understand what is the value behind that system, why we have put in place a protocol for vulnerable patients, why we have a protocol for patients for emergency. So if they really understand, then they'll make changes to that. So making people understand the value system values behind the system and practice it, and creating that alignment is also the responsibility of the leader or the ophthalmologist who runs the practice. So if you are able to do that, if you are able to bring in that alignment only, then you'll be able to sustain the value-based work culture. Otherwise, you can create a structure, but it may not refine by itself. Okay, that's where it becomes very important. The third is we need to have staff with the correct attitude. So that's also important. So having these value systems is one part, because the knowledge and skills can be acquired or transferred by various ways, but attitude is difficult to be taught. So hence it's always better that you take your own staff and train them, instead of laterally hiring them. If you are able to get your staff, it may take some more time, but you are able to inculcate all the values. They are not kind of corrupted by what they had gone through the previous work experience. So whenever you get a staff, these values have to be inculcated right from the beginning. So that is where, when you're hiring, the value fit is very important than the skill fit. So when you assess the person for the values for which that person stands for. And you should have a way how to assess that value system. That is what is really important. The fourth important point is, how do we align the staff with the vision and mission of the practice? So it's not necessary only that a big practices, big institutions should have a vision. Everyone, each one who's got a practice, each one has got a team. If you're going to work with a team, then you need a vision for your practice or for your hospital. And this should be simple, and it should be able to also be clearly stated. So you can, this is the vision is about, what is the overall purpose of the practice or the hospital. But you also make the staff understand how we are going to achieve that. That is what we are talking about mission, and I mentioned the 7 pillars, which kinds of helps to run Aravind, which is making eye care accessible. It's about quality, patient centricity, self-reliance, frugality, staff centricity, and sharing. So these we are really understand, and every staff, when they join, they get to hear this. It's like 1.5 to 2 hours presentation. So this aligning the staff with the vision and mission of the practice is very important. So not only you have to align them with the overall vision of the organization, but every staff really have to understand how their department, how her work is going to contribute to that, whether it's medical records department or housekeeping department. The housekeeping department, the mission statement says that to contribute to Aravind's mission of eliminating needless blindness by providing a clean, pleasant, and functional environment for both patient and staff. So if you are able to clarify this statement, that gives a lot of clarity to the staff also to work, and we can talk about later how they are going to implement that. Similarly, a medical record department talks about how that contributing to the mission of eliminating needless blindness by recording all relevant patient information accurately without any time delay and providing timely reports to support effective decision making. So they really understand the value of their work, and what that work they are doing is going to contribute to the organization. So I think clarifying to the staff also becomes very important. And again, these values we also need to cultivate through training. For example, putting an eye drops is a simple task, but how they put that eye drop. So when we train them, we have to really give instruction to the staff as to what kind of instruction they'll give the patient before and after installation. Because some eye drops can cause burning, patients have to keep their eyes closed, they may have a blurred vision, all of that, and it's also including providing a simple piece of cotton for them to wipe. So all of that makes a difference to them. And again, how they do it, the body language, the voice modulation, all that, and how they are supposed to do it also we have to teach them. And the kind of role plays, there are several role plays they do, wherever there is a patient interaction, all that is very important. And again, the excellence in training, who will do this training? So there are several hospitals bring people from outside to do this training. That's not probably, you can probably transfer the knowledge part and the skill part, but you can never transfer the culture part. So how you do the work, there is also beyond the knowledge and the skill, there is also an element of culture as to how it is done. Only the people who work in the organization, they know it. The senior people who are really good in work are the people who should be made as trainers for the subordinate, the next batch of people who join the organization, and you have to choose the appropriate people to do that. So that is, so people who are excel in clinical care are the people should be given the responsibility to do the training. The other important thing is how do we empower the staff? So if the doctor takes all the decision, probably it's very difficult to grow the values. And empowering the staff to make a certain decision on behalf of the patient, okay, it really energizes them, but you give them a framework on which how they make a decision, so they don't have to come to us. So we said, we'll do this 2-3 procedures together, but we decided not to do a procedure, but this has to be refunded. If this person can do it by themselves, there is going to save a lot of time, and the patients are also going to be very happy. If they are all involved in day-to-day planning and other resource allocation is also important. So how do we find how really you can empower your staff? That's also really important. And then it's all about developing leadership at all levels. Again, having regular team meetings, everybody meeting together, it's very important if you want to grow as a team, because strengthening that bond between the members as a group will happen only through the team meetings. This also helps in kind of a shared responsibility. So well-aligned teams are more productive than individual contributors. There may be somebody can be super, but what a team can achieve that individual can never achieve alone. And to come how do we really sustain these values? So this is where we need to really connect with the patients. So if we don't connect with the patient, also we cannot sustain the values. So because we've seen earlier, the systems kind of enforce the values, but only if we have a feedback that will aid in reflection. That's where the patient satisfaction surveys all become important. So there is many ways you can do this survey. You can either do a direct survey when the patient is there at the hospital. You can do a phone-based survey. If there is a problem, then you can do an in-depth survey to a group of patients. You can also have a call center. If the number of phone calls are coming in an organization like yours, then you need people who will be able to address them. So based on the need, you have to look at all of these things. Just I'll give you an example. So this is a feedback from the patient. So look at, so what we have shown here is the reasons for satisfaction. So if you see the one that scores very high is the hospital cleanliness more than the doctor's care. Okay, so they really value that. It's very important. So sometimes you need to give importance to that. That makes them also. So they look at the nursing care, doctor's care. If you are low somewhere, I think you need to address that as well. Equally important is why they are not satisfied. So in our case, I'm just sharing. So this is a waiting time. Waiting time is something, they are not really happy about it. We need to address this either as a system or the communication to make sure that the patient really understand why they are waiting. So this, if you are able to share, and again, this is from the Google. If you go to the internet also patients judge you. They rank you. And all that is also captured every month and shared between the hospitals. Whether their rating has gone up or gone down is also shared. So this feedback is very important. Again, involving the patients with the patient focus group discussions. This focus group discussions, it happens at least 1 or 2 discussions happen every day where about 10-15 patients join. 1 or 2 doctors, 2 or 3 MLOPs, mid-level personnel are also join the meeting. They really hear firsthand from the patient what they appreciate and what they don't appreciate. So some way if you are able to connect the staff with the patient through your feedback, if they really understand. If as a senior leader, I'm going to tell them, no, this is not correct, but instead if they really hear directly from the patient feedback, it has got an enormous effect on the behavior of the staff. It also helps, in training the staff in communication. And again, it also helps in aligning with the overall vision of the. And again, what is also, there is one other time we can connect to the patient. That's when we examine the patient. Not only the doctor, but also all our subordinate staff. Now, this is not about talking to the patient about his illness, but it's talking about to the patient about their social status, who they are, what they are, what job they are doing, what is their family. So we always have, that spending the 2 or 3 minutes, you will have a much better trust with the patient. There will be much better acceptance, compliance, less medical issues. I'm very sure that many of you here will be doing that. Whoever is doing that, they are not going to have a problem. They'll have much better acceptance, they'll have a great practice, and they'll also don't have to spend their time with the lawyers. So basically, these are the 9 important points I would like to share. Just to, it's all, you need to build this ecosystem. I think this, some of us will be doing it, but if you do it with an understanding of, how do you create a system so that we are able to really put in place a values, create a work culture, so that, we really give a good patient experience and satisfaction. And I will also say that it's about, ordinary people doing extraordinary work. If you give a framework, if you create a system, even ordinary people can do an extraordinary work, if they really understand, do the work. So I'll give you an example, as you all can see. So now we insist, many of our mid-level ophthalmic personnel, when they join, they are all from rural background. Most of them don't wear sandals or footwear. So we make sure that they all wear. So if you see, this girl was not wearing a sandal, and when she came, she was bringing a patient from one building to another building, from a free hospital to the paying hospital. And she came into the hospital, she took the sandals, footwear from the patient. Then this was noticed by a senior member of the hospital, and the person asked, why are you taking the footwear from the patient? Then the staff said that, this lady, it was so hot on the road, I gave my sandals to the patient. Okay, so this is not part of our teaching and training. But if the value, the compassion is important, This empathy is important. Then they respond to that, when the need arises. This you cannot teach. There are several situations in our in our hospital day-to-day interaction where the staff have to use their judgment to react with the patient. So that's where a value-based teaching and training, making them really aware of all the values, becomes very important. And again, building a culture for patient satisfaction is about building a team spirit. Okay, so when a team, our hockey team wins or cricket team wins, we talk about team spirit. So what does it mean? It's an excellent coordinated work. So here I can say this spirit is the life force of values and culture that connects and transcends the physical, mental complex of individual team members. So this is what will really bring together the whole team. This is what will bring the team spirit, and this is what will make an organization succeed or go down. And it's also about transformation. Okay, it's about how do we connect the mind and the heart, and it's about bringing a true alignment of the staff. If the people are really aligned to the values, the real values, which we all cherish. So we all know, as a person, as an individual, we all know what is correct, what is not correct. Okay, our staff also know. If the staff are aligned, told very clearly that we have to do what is really correct, then you're going to bring a lot more energy. And every day, in our practice, we have a challenge. Every crisis is an opportunity to reshape the DNA of the staff and the organization, but we need to use it. But if you let go the crisis, the challenges, if you don't address it in the proper way, so that we put in place a value, how that some value was violated, how are we going to address that? If we have a conversation, then you are going to build a different DNA in the organization. So, and just to conclude, I would like to use Dr. V's. This is something he really talks about again and again. He says that when we identify ourselves with all that is in the world, there is no exploitation. So this is really important, especially in a service industry like medicine and education. I think all of us who are leaders here should have that. And he also says that, I'm not helping that person. It is ourselves we are helping. It's ourselves we are healing. By treating the patient, I'm not healing that patient. Actually, I'm healing myself. So this is taking people to a different level, a spiritual level, from which, if you really do things, I think you will have definitely a different type of a practice, hospital, and a organization. Thank you.
Thank you, sir. That was a wonderful oration, and it's so nice to hear non-medical topics being put across, in such a wonderful manner. And we admire the work that you are doing, the service you are doing for the society. And once again, on behalf of KSOS, a big thank you to you, sir. Please give him a standing ovation.
We'll be starting the quiz right now. So we